My name is Monica. I'm from Miami, Florida. I'm an RN. I have an associate's in social work, and then I got a bachelor's in psychology. And I was working in case management. I've worked in the medical field since I got out of high school, and it always intrigued me. I always loved it. And then it came a moment where it was like, go to graduate school and get my master's in social work and my license, clinical social work, or go to nursing school. And I chose nursing school just because I felt like a lot of my patients lacked education, like very basic information on what medications to take at what time, those types of things that were like, it was astounding. And I just felt like there was a need. And so about 3 years ago, I decided to go back to school and I got my nursing license. As far as geriatrics, it's a very special population. We're talking about people that are basically towards the end of their life. You know, their children have moved away, their grandchildren are moved away, and they're very lonely. So you have social dynamics, you have social economic issues. A lot of them are living off of their social security benefits, so they need a lot of assistance, and they just need somebody to talk to. You know, they it's just a special population because you want to give them that dignity in the last years that they had, you know. And they're just special because you hear stories of their lives, and they're so, I'm going to get emotional, but it's very inspirational. You know, you hear these stories and it's just like, it inspires you to live your life to the fullest, like all the time, you know. So that's why, like I said, when I was 18, I started working at a doctor's office as a receptionist. And that doctor was internal medicine. And so most of his patients were, you know, older. And it just developed from there. And I grew to love that population for that reason. My favorite part is when I can like solve a problem, you know, like when they're having a situation and they feel overwhelmed, um, because it is scary. You know, it's scary for them. It's scary for their family. Their family sometimes doesn't know how to help. If they don't live close to them, they're like, how do I get them this? And I need to pick up the medications, and, you know, so certain things that seem very overwhelming at the moment. And when I can solve that problem for them and tell them, okay, this is already done, this is taken care of, you know, the pharmacy, you can go at this time, the pharmacy will have the medication ready, or, you know, those types of things. And when they have their problem solving, they're just so thankful. Like it's rewarding, you know, when you can just like help out that little bit. When I have a patient that is not able to make their own decisions and everything, I'm not speaking to them as much. I mean, I will talk to them, but I'm more like, if I need to get specific information, I'm getting it from whoever is their caretaker. I'm not getting it from them because they won't be able to tell me what medications they took that morning, or if they're drinking water, if they had, when was their last meal, are they cutting out their sodium, like those types of things they won't be able to tell me. um but then so yeah, I do have like my responsibilities are, if I need to ask specific questions about their care or their medications or anything, I'm going to their caretaker. If I have questions um like, if I have anything, like, you know, how was your day, what did you do today, or just like, you know, just trying to like get them talking, and they need that socialization, especially when they have like deficits like that they're like, they have like dementia or Alzheimer's or whatever, they need that stimulation. So that I do. But when the ones that don't have any like memory deficits and whatever, I can just talk to them normally. So it's just a matter of like what information I need to gather. My job is more like discharge planning, you know, because my patients are usually patients that were in the hospital, or in a like we're discharged to a rehab center for physical and occupational therapy, and then I'm trying to transition them back home or to an assisted living facility or something like that. So I don't have like those activities that we do, like, you know, little things like that. I'm trying to educate them and help them get to be home safely. So my best part is when they are able to go home safely and I'm able to keep them out of the hospital, and they're able to, you know, just go back to a prior level of function, or like a prior independence. At that age, that's all they care about. They just want to go home. They want to be in their home. They don't want to go anywhere else that's not their home. They want to be with their things. Like they get very um like, not territorial, but very like, don't take me away from this. This is what I know and this is what I love. And I just have like a few years, you know, like they're very cognizant about the fact that it's towards the end of their life, and they just want to have like no change. So it's very rewarding when I'm able to help them like have that stability, like stay home, you know. And sometimes it's not possible, and sometimes, and that's a hard part too, when you're having that conversation, like you're not going to be able to stay home, and you know, you might have an accident at home, so you need more help and stuff like that. But I guess the most rewarding thing is like when they're able to go home. I want people to be an RN if they want to be an RN. It's a very difficult job. It's very trying. It's you deal with a lot of, like, a lot of humanity. Like, you see really amazing, beautiful things that just give you like so much hope in life, and then you have such horrible things that you're just like, I don't even know how I'm gonna make it. Like, we had a joke in nursing school that they would have like a week, like midterms week, and they would have like these like meditation and zen rooms, and we would always joke, like, we're like, where's the crying crying closet? Like, we need a crying closet. And I feel like every hospital should have a crying closet, because I've been in clinicals and I've had to step out of the room to go take a moment and take a breath and cry, because there are moments that are very emotional. So if a person has that feeling like, I want to help and I want to do just a little bit, then by all means do RN. But I had a conversation with a close friend a few about a year ago, and she was thinking of going to nursing school, and I'm like, if it's not your passion, don't do it. Please don't do it, because it's not what you're gonna think it is. Like, it's not what you're envisioning. It's very heartbreaking at times. It's beautiful, it's rewarding, but it's heartbreaking. I work out of my home, making phone calls and stuff like that. But I have had several patients that have contracted COVID, and they've been in rehab and they've been discharged home and so on and so forth. So I have had some situations with some patients that have had COVID. So when COVID started, I was in my last term in nursing school, and we were on clinicals. And two weeks before we were done with that rotation, we were sent home because the pandemic started hitting. And sorry, the pandemic had reached Florida, and all the hospitals started shutting down. So any nursing students or anything like that were sent home. Um, and my job, what I do, has always been like telephonic and visiting rehabs and stuff like that. So obviously once that happened, I couldn't go to any rehabs or anything like that because they weren't letting anybody in. So then it just transitioned directly telephonically. So I haven't been inside a clinical setting since the pandemic began. A nurse's job is just like one fraction of like an illness. You know what I mean? Like, it's a big fraction, but so is the EMT who got the patient into the hospital in time, like, you know, kept them alive long enough to get to the ER, like, you know. And then the social, like, it's just, it is all encompassed. Like, we all work together, and it's a beautiful thing. You know, we're having a nurse shortage. We were already having it before the pandemic. So now after the pandemic, it's becoming even more evident. And I absolutely want every person that feels that calling to really don't let anything stop you. Don't let how scary it is, because nursing school is terrifying, and I'm not going to downplay that, but don't, not to let anything like that stop them. Like, if this is your calling, you can do it. Anybody can do it. But I want, more than anything, is for people to see how much all of us have been doing before the pandemic. With the pandemic, everyone's like focused on healthcare and frontline leaders and all of that. Um, but and that's wonderful. But we've been doing this work for hundreds of years, and it's a beautiful thing. And I'm glad that people are looking at the attention for it and everything, um, and giving it the attention. But I want to make sure that, like, that people see that this job is um more than the pandemic, really. Like, it's something that has been going on before the pandemic and after the pandemic, and we just we go into it with our hearts. It's a heart thing, and it's just important that we put a light on how much work that they do all the time and how special it is.